Thank you for joining me. Today, we're going to talk about whether or not hormones cause cancer. And this is an extremely important topic because it is strongly believed that hormones cause cancer. And it's one of the reasons why a lot of people steer away from taking hormones. If you were at my initial talk, then you will have seen that I talked about all of the benefits of hormones. At my second talk, we talked about all the benefits of testosterone. Today, we're going to talk about hormones in general. And next week, we're going to talk about whether or not your spouse should be on testosterone. And then the last one, we're going to talk about pellets. So we're going to jump into this extremely important conversation. And if you have questions, feel free to put them in the chat as we go along. All right. So this is important for you to understand when the context of me talking about hormones. So understanding who I am and what my training is really important because you'll find that around this topic of hormones, that many different doctors have many different opinions. You'll go to some doctors and they'll say, do not take hormones because it will cause cancer. You will go to other doctors who will say you need to be on the lowest dose for the shortest amount of time, and else it will cause cancer. And then you'll have doctors like me who are like 99.8% of the population should be on hormones as they go through menopause, and you should be on it for life. So there's this huge gamut, and that has to do with training. First and foremost, I'm a board certified physician in internal medicine, which means I went to medical school. This has I'm going to say no bearing, but it has very little bearing on the topic we're talking about today because medical school didn't teach doctors, any doctors, not just me, about hormones. So that history means that I had to learn about hormones elsewhere, and where I learned about hormones makes a difference. I put here my certification. So through the Institute of Functional Medicine, that also tells you a little bit about me. I think about things from a slightly different perspective about root cause. Why do people get sick in the first place? Why do people have adverse effects or develop disease? And how do you stay healthy? So that's my perspective, which is slightly different than a conventional route. And then as far as the way I prescribe hormones, that training came from two specific companies, Avexapel and A4M, the Academy of Anti-Aging Medicine. So all of that shapes what I'm going to tell you. But what I'm going to tell you today is all going to be evidence-based. And really my goal is to help you understand how to interact with your doctor or whoever's your care provider when it comes to hormones. But I think the biggest certification that I have is one that I gave myself. I made up that logo myself, menopause certified, perimenopause certified. That means I am going through perimenopause. And that, as a physician, has really shaped the way I treat patients because I physically know what people are going through. All right, so overview of what we're going to cover tonight. We're going to talk about what hormones. This is really the key to understanding everything else. So understanding the hormones we're talking about is important. We're going to talk about right at the beginning, whether or not hormones cause breast cancer. You can possibly know that from the way I'm talking about it, that the answer is no. So I'm just going to tell you that right up front. And then we're going to talk about the study that changed everything and why so many people believe that hormones cause cancer. And then we're going to talk about the risk factors that actually do increase your risk of cancer. And then I'm going to delve into how you assess yourself. Because like I said, if you're going to go to a doctor that's not me or someone who has been trained in the way that I've been trained, you need to be able to advocate for yourself. So I'm going to give you the tools to be able to assess for yourself what your risks are. And then we'll talk about how you decide whether or not hormones are right for you, given your risk. And then also, I will tell you about how I think about hormones and give you my conclusion based off of all the evidence that I present to you today. So what are hormones? And I'm going to blow in and out because anyway. So what are hormones? And this is important because when people say, do hormones cause cancer? They give this really blanket generalization as if all hormones are the same. And this is the key to why it's so difficult for people to really understand the risk that they have, because we make this bucket list of saying hormones, not really being very specific. And it's not just generalities that doctors talk about. In the research, the researchers use the word hormones, and they're not being specific enough to the hormones that they use. So you may have heard the word bioidentical hormones. That basically means that they're the exact same chemical structure as the hormones that your body already produces. So as women, we produce estrogen, 3 different types of estrogen, progesterone, and testosterone. These have a specific action in our body, which are necessary for our vitality and our health and our vibrancy. throughout our life. They're responsible not just for pregnancy, but also for brain health, heart health, whether or not you gain weight and where you gain the weight, whether or not you build muscle or not. So these hormones are vital to life, not just your reproductive organs. Then we have synthetic hormones. So synthetic hormones can be anything from birth control pills, which we won't discuss today, but these are not the same thing as the hormones that you make in your body. But in this case, we're going to be talking about synthetic hormones that people use for menopause. So there are some very specific ones, and I'm going to try not to use too many technical terms, but some of these terms are important. So conjugated equine estrogen is the specific type of estrogen that was studied. Progestins, this is a class of hormones that are made to look like progesterone, but are not progesterone and do not act as progesterone. And then we have synthetic testosterone. So what a lot of people think about anabolic steroids, what makes women look like men, which is not the same thing as the testosterone that you make in your own body. So this is really important, even though we're not going to talk about testosterone. We talked about that last week, but the difference between estrogen, conjugated equine estrogen, progesterone, and progestins. There's another estrogen that is sometimes prescribed, ethinyl estrogen or ethyl estradiol, which is also synthetic. If you're looking at your own package and you're like, mine says ethyl estradiol, that is also synthetic. All right. So do hormones cause breast cancer? The answer is no. I'm just going to tell you that right up front, but I'm going to explain to you why so many people think that it does. And that has to do with something called the Women's Health Initiative. So before the Women's Health Initiative, people were taking, all the way through the 80s and 90s, you see this huge uptake in women taking hormones. And there was this general thought from observational studies that their hormones might play a role in breast cancer, but the risk would be so small that nobody really cared. So they just continued to prescribe hormones. But eventually they said, well, let's do a study and actually look at it. And the way in science that we get more of a definitive answer is to do something called a randomized controlled trial. So the National Institute of Health put on this huge study, the largest study on hormones ever. And there was, this study looked at a lot of things, but there were two specific arms that are of concern to us today. And those two arms were one group of women who took conjugated equine estrogen, which is a form of synthetic estrogen, along with MPA or medroxyprogesterone acetate, which is a form of a progestin, not progesterone. So we had one group who took both of these, Premarin and Prempro, together. We had another arm that just took conjugated equine estrogen. This is important. I'm not saying these things to confuse you, but it's important that you understand that these are the names of the medicines that they used in the study. The goal of the study was not to look to see whether or not hormones helped with menopausal symptoms. Everybody agreed that they did. That wasn't even of concern. But what they wanted to see was whether or not if we give women hormones, does it cause people to have heart attacks or does it protect heart attacks, women from having heart attacks, and does it increase the risk of breast cancer? So that's what they were looking at. So what were their findings? So in the group that had a combined conjugated equine estrogen and MPA, they found that for every 10,000 women, there were 7 increased heart attacks, 18 cases of increased blood clots, 8 additional strokes, 8 additional breast cancers, 6 fewer colon cancers, 5 fewer hip fractures. There was no impact on all-cause mortality. So this means that even with all of the people of the people here who had an increased risk of heart attacks, blood clots, strokes, and breast cancers, that did not increase their risk of death, but did increase their risk of having these conditions. And 97.5% of the women who were in this study had no adverse effects at all. If you can imagine, this was somewhat shocking, but probably not as shocking as it was made out to be. So let's look at, we're going to come back to it. Let's look at the other arm. The other one that looked at just estrogen, conjugated equine estrogen, showed that there was a trend for increased stroke, meaning that we didn't actually see a definitive answer to whether or not it increased the risk of stroke, but there was a trend towards that for women over the age of 60. There was no increased risk of heart attacks or breast cancers, and there was actually a 22% decrease in the incidence of breast cancer and a 40% decrease in the risk of dying from breast cancer. So these show two very different things, but the study where it was just the conjugated equine estrogen actually showed that it was protective, that estrogen was protective in breast cancer. So you take these findings and what happens? there was this huge media outpouring that said hormones cause cancer. Now you can see again why using the term hormones generally is not the way you want to talk about this. If anything, you're going to say progestins, medroxyprogesterone acetate, slightly increase the risk of cancer. That would have been the most appropriate way to handle this situation, but that's not the way that they handled it. They put it on the cover of Time and every news report that hormones in general cause cancer. And so in this graph down here is that you see these lines are basically showing you the uptick in the 90s of people who were taking hormone therapy. And then right after this study ended in 2002, you see a drastic drop off of the women being prescribed hormones because it scared the living bejesus out of everybody. Everybody stopped taking hormones and they were like, hormones cause cancer. So everybody stopped doing it for 20 years. So here's the problem. And I'm not going to get into all the details of it, but here are the big issues. Number one, remember I told you that the women that they studied for this were women that they were looking to see if that increased their risk of heart attacks. You would study older women to figure that out. So the women in this study were not the healthiest and they were not the average age of the woman that you would put on hormones. So the average age of someone you would put on hormones are women who are going through perimenopause and menopause. So maybe in their late 40s and 50s. This looked at women who were in their 60s. The reason this is important is because starting women who already have heart disease on hormones can play a risk in their risk of having future heart attacks. So that's the heart attack part. The type of hormone that they used, that conjugated equine estrogen, they took it orally. That means they took it by mouth like a pill. And what we now know is that if you take estrogen by mouth, it increases your risk of clots. But if you take estrogen on the skin, it does not increase your risk of clots. And so that covers this whole stroke and increased clot thing. So if you start women younger and you don't give them oral estrogen, that gets rid of a lot of the problems that we saw. But the big issue as it pertains to cancer was the difference between progesterone and progestins. So I want to spend a little bit of time talking about the difference between these two chemicals. So progestins are a synthetic derivative of progesterone. They are not the same as what your body produces, and they act differently. So much to the fact that when you think about taking a progestins actually stop pregnancy. This is why we use progestins and birth control pills. And progesterone actually promotes pregnancy. That to me, when just thinking about that, where everybody's, oh, these are all just progesterone, we're just going to lump them all in the same class. And you're like, there's no possible way that these two chemicals could be the same when one causes pregnancy and the other one prevents pregnancy, when one causes cancer and the other one prevents cancer, where one has a very generalized effect on the body and the other one has a very specific effect on the body. One causes mood swings, bloating, and increased clotting, while the other one has a calming effect and promotes sleep. So the progestins in and of themselves are problematic, but the reasons why we develop things like progestins is because, for example, with the use of progestins and birth control pills, we made a chemical that would prevent pregnancy, and we did that by altering the progesterone. But in hormone replacement therapy, we don't want to alter somebody's ability to get pregnant. If you're menopausal, you're not getting pregnant anyway. You don't need an altered chemical. What you actually need is to replace the hormone that you already had, which is a bioidentical form of progesterone. So the reason this is really important, if you haven't gotten it so far, is that the study that scared everybody about hormones causing breast cancer weren't the hormones that we even use today. And they weren't even the hormones that women take. If you're really interested in taking a deep dive into this, a really great book to read, there are lots of great books at this point, but I think the best argument about what was wrong with that study was in the book called Estrogen Matters. Take a screenshot of this. This is a great book to read. But basically, they concluded that number one, estrogen does not cause breast cancer. Number two, taking hormone replacement therapy has lots of benefits, and that by keeping women off hormones actually cause more harm than good. So what did we learn? Just to recap, starting hormones early, meaning within the first 10 years of menopause, is really important. The type of hormone or the hormone structure, so taking bioidentical hormones rather than synthetic hormones, is really important. If you're taking estrogen, you want to make sure you're taking it topically. You just want to avoid taking it by mouth is the key. There's still doctors out here today that give estrogen by mouth, and I don't understand why. And then you want to make sure that you're taking your progesterone orally because that's what helps with the mood and sleep. The duration of use and the dosage, I do think that this is an area that it has a lot more controversy, and I think more studies need to be done in this area. There will be some people who say you shouldn't take hormones for a long time, no more than 5 years, and then you should stop. And then you have other people like me who, as I said before, will be on hormones until I die. Okay, so other factors that affect outcomes. So this is what's really important, I think, is to understand risk. As a matter of fact, I'm going to show my face again because I'm so animated when I talk. I feel like I'm talking to myself. So there's this neurophysicist that I really like. You guys may have heard of him, Neil deGrasse Tyson. And he says this thing that I think is so important here, that humans have a really bad understanding of risk. We just innately don't understand how to assess risk versus benefit. And the rest of this talk is going to be targeted towards you understanding how to assess your risk. And so there are a lot of things that do, in fact, impact whether or not you develop breast cancer. Genetics is one. It's actually a smaller version than a lot of people believe, but a lot of people think if anybody in my family had breast cancer, then I am at risk of breast cancer, and that's not true. It's really a small proportion of women who have family members who have breast cancer that increases your risk. And so genetic testing is important for that, and your doctor will know whether or not you need to be genetically tested. Your weight plays a huge role in whether or not you develop breast cancer. How your body responds to the hormones you're taking. So we talk about receptor sensitivity. Again, this is something that your doctor may or may not understand. Underlying conditions, whether or not you have a history of breast cancer, when was that? Is it completely cured? Do you have remnants? All of that's important, whether or not you've had heart disease. Other lifestyle factors, like if you're a smoker, alcohol use, if you are inactive and aren't moving a whole lot, your breast density, the foods that you eat, your liver function, inflammation, all of these things have very real impacts on whether or not you would develop breast cancer. So before people get all up in arms about taking hormones, these are some issues from a holistic standpoint that I would urge people to address first, because the risk for these things are so much higher than the risk of taking hormone replacement therapy. And I'll actually show you those risks coming up. So the bottom line, again, I can't repeat it enough, estrogen does not cause breast cancer. And in fact, even in the Women's Health Initiative, conjugated equine estrogen showed a 22% decrease in the incidence of breast cancer and a 40% decrease in the risk of dying of breast cancer. I repeat this over and over again, because if you've heard something different, you're going to continue to be like, oh, is she telling, who's right? Who's telling the truth? Why won't my doctor prescribe it? Why is my doctor telling me that it's going to cause breast cancer? Even in the study that caused all the uproar, we actually showed that estrogen protects against breast cancer. So that's that. And then as far as bioidentical progesterone versus progestins, there have been a few studies that looked at bioidentical progesterone that showed that there was no increased risk of cancer. But the issue that still lies unanswered is that there are no studies that look at progestins against progesterones and say definitively progesterone is safer than progestin. So this is why a lot of doctors are still scared of prescribing. So let's talk about assessing your risk. So again, we talked about some of these risk factors, but I really wanted to help you quantify the risk of one thing versus another. So if you drink one alcoholic beverage a day, you increase your risk of breast cancer by 7 to 10%. If you drink more than that, 2 to 3 drinks a day, you increase your risk of 20%. So that's about 4 to 5 additional cases per 1,000 women increased risk of breast cancer. Compare that to the Women's Health Initiative that showed that progestins, the hormone that we're not even going to take these days, actually increases your risk of breast cancer. That's down here in this lower right-hand corner, less than 1 additional case per 1,000. So drinking alcohol increases your risk by 4 to 5 additional cases, where progestins are less than 1 additional case. Your weight, if your BMI is higher than 30 or 35, increases your risk by 5 to 7. Compare that to less than 1. Inactivity increases your risk by 3 to 5%. So if you're an active person, you're actually decreasing your risk of breast cancer. Processed foods increase by 2 to 3%. Smoking, 5 to 6 additional cases per year. So you can see that there are things that increase your risk. Hormone replacement therapy is not one of them. All right, so decision making. So the really important thing that even all of the different professional societies that talk about hormone replacement, the one thing that we all agree on is that whether or not you as an individual decides to be on hormone replacement therapy is a personal decision that has to be made with an informed consent. So these are the things that you want to think about for yourself about whether or not what your risks are. So you want to know, number one, what type of hormones is that doctor trying to give you, bioidentical or synthetic? You want to think about how old you are when you start hormones. That doesn't mean that if you're 10 years past menopause, you can't start hormones. It just means that maybe your risk is slightly higher of developing a heart attack. Your lifestyle. So do you drink alcohol? Are you overweight? Are you inactive? Do you have a really poor diet? Do you have a lot of stress that you haven't developed the skills to manage? All of these things play a huge role. Do you have a family history of breast cancer? Do you have a history of breast cancer? Was it receptor positive or negative? So here is one thing that I think is of concern. If you have a breast cancer that is ER or PR positive, that's estrogen or progesterone receptor positive, those people I would probably recommend not going on hormone replacement. That just basically means that these are cancers that have been shown to increase their growth when you are on hormone replacement, okay? But even if you have a family history, it doesn't mean that you can't be on hormones. It just means that's something we need to discuss. Again, from a heart health perspective, how healthy is your heart? And then this is one that I think is actually quite big, and one of the reasons why I'm happy you're here listening to this talk today. If you are scared of starting hormone replacement therapy, that is real. It's a real thing. I know plenty of women who are like, I hear everything you said, Dr. Peoples, but honestly, my mother had breast cancer and I don't want to take any risk, even if you're telling me that there's no risk. And that I think any doctor should respect. I think you should also respect that. Don't let anybody push you into something. And this goes with any therapy that you're not comfortable with. All right. So what are my conclusions? This is really small, so I'm going to blow this up. So we've talked about some of these. The estradiol or estrogen does not cause breast cancer, but may promote growth of cancer that already exists. So this is why you need a mammogram before you start hormone replacement therapy. You want it to be negative because even though estrogen doesn't cause breast cancer, if you have an ER/PR positive breast cancer and you're on hormones, it can increase the rate of growth. So that's something that's important, and it's an easy thing to avoid. Vaginal estrogen can be safely given to any patient with hormones. So if you have vaginal dryness, don't be afraid of taking vaginal estrogens. Estradiol should not be given by mouth. Again, that increases your risk of blood clots, heart attacks, and strokes. So if you're going to take estrogen, you put a patch on. Now, number 4 here is actually a place of difference that I may differ with some other doctors. And that is the indications for hormones. So a lot of the National American what is the word? NAMS is the acronym, National American Menopause Society, thank you, states that the only reasons you should ever be on estrogen replacement therapy is if you're having hot flashes or difficulty sleeping. But I would beg to differ, or if you have vaginal dryness. I would say there are a lot of other reasons why somebody might want to consider hormone replacement, and that includes sleep, anxiety, depression, mood swings, brain fog, mental clarity, osteoporosis, dry skin, hair thinning, joint muscle pain, fatigue, libido, heart disease, and quality of life. So if you have any of these symptoms, come talk to me or talk to a doctor about starting hormone replacement therapy. And as far as progestogens go, so this is progestins or progesterone, we know that progestins likely increase the risk of breast cancer, but the absolute risk is very small. So that's 8 in every 10,000 women. If you're taking progestin, do not confuse that with progesterone. And even of that, again, that risk is much smaller than if you drink a glass of wine every night, or if you're overweight, or if you don't move. So the risk of those things are much higher than even if you take the progestin. Number 2 here, bioidentical progesterone does not cause breast cancer and may actually be protective. You replace progesterone regardless of hysterectomy. So here's another area where I differ, that a lot of women will say you only need to be on progesterone if you still have a uterus, but if you've had a hysterectomy, you do not need to be on progesterone. And I do not agree with that, because this is the assumption that progesterone doesn't have its own beneficial effects in women. So what are some of those beneficial effects? So in premenopausal women, abnormal periods or like heavy bleeding, PMS, postmenopausal or premenstrual dysphoria, oh Lord, PMDD, my brain is off tonight. Anxiety and insomnia might be reasons why a premenopausal woman might want to be on progesterone. And fertility, I didn't put that there. In perimenopause, fatigue, mood swings, sleep abnormalities, abnormal periods, migraines, hot flashes, all reasons why a perimenopausal woman might want to go on progesterone. And for postmenopausal women, sleep, anxiety, depression, bone health, hot flashes, cognitive function, and uterine protection. So protecting yourself from uterine cancer. So all of these are reasons why someone might need to consider progesterone. So there are some other really important aspects to think about. So talking about health span, I'm not going to go over this too much because this talk is mainly about cancer, but there are other health benefits to being on hormone replacement therapy. And then I do want to just highlight this is that I think every woman who's deciding whether or not she wants to be on hormone replacement therapy or not needs to understand that the research here is still evolving and that there are still some unanswered questions. So research is still needed, but it may never happen. And the reason is that millions of dollars were spent on the Women's Health Initiative, and it is unlikely that millions of dollars, particularly in this political climate, that they will be doing this study ever again. So the study that we really want to look at progesterone versus progestins may never be done at a large scale, but there are a lot of other types of studies, observational studies, epidemiological studies that have been done and will continue to be done. That we need to, in research, if you are ever talking to a doctor about this issue of hormones, you want to make sure if they ever pull out a study in front of you and say, this is the study that shows that estrogen or hormones cause breast cancer, you need to ask them what hormones. We talked about that in the very beginning. Which hormones are you talking about? Are you talking about bioidentical hormones or synthetic? And then the questions that I still think are very valid that are still need to have answers to is the long-term effects of being on hormone replacement therapy. My philosophy here is that we are just replacing. How can I get myself back up here? We are just replacing the hormones that your body has naturally had. We're not giving you any abnormal or things that your body is not used to seeing. We're giving you estrogen, progesterone. Your body has had estrogen and progesterone for 50 years. And if you plan on living another 40 or 50 years after that, so if you plan on living a healthy lifespan, being on hormone replacement therapy throughout that duration could be prove very beneficial to your health and your well-being. But we don't have any studies that actually show that. So that's really important. And then also the absolute risk assessment of therapy. So I wish that at the end of this talk, I could tell you, this is your risk. Like in heart disease, we have a calculator and we put it in the calculator and we say, if you're this old and you have this risk factor and this risk factor, this is your percentage likelihood that you're going to develop heart disease. We do not have anything like that for breast cancer or any cancer. All we can say is that we know the things that increase your risk. We know the things that decrease your risk. And if you are taking a holistic perspective to your health, then we should be able to mitigate your risk, but we'll never be able to make your risk zero. I wanted to end by telling you that if you are in the city of Atlanta, or if you are in Georgia and you would like to discuss hormone replacement therapy with me, if you scan this QR code, it will let you register. Even if you can't show up, scan this QR code and you'll get more information. So that is the end of my talk. I am opening the floor for questions. If anyone has questions that have come up, please let me know. So I see one. So I had uterine fibroids that were removed. I researched that they grow due to excess estrogen. Will I be risking them returning if I take estrogen in perimenopause? So the fibroids is a very tricky one, I have to admit. So women who have like large fibroids and have significant bleeding from those, yes, estrogen can absolutely cause those to bleed more. Does that mean you should not try estrogen? No, it depends. I think there needs to be a discussion about whether or not you still have fibroids, whether or not they're heavily bleeding, whether or not you've had any procedures to erase them or mitigate them, and then talk about hormone replacement with estrogen. But people, as we talked about last week, there are three major hormones. There's not just estrogen. There's progesterone and testosterone. And progesterone and testosterone might be a good option for a woman who has fibroids and can't tolerate estrogen, because testosterone and progesterone do a lot of the same things that estrogen does. Estrogen is important, don't get me wrong, but it's really about balance. And then the other thing is that sometimes with excess uterine bleeding, balancing it with the right dose of progesterone might mitigate those fibroids. Again, and then adding in lifestyle stuff. So making sure you're eating a diet that's high in vegetables, make sure your microbiome or your gut health is in place. So there's a lot of things that you can do. So I wouldn't make a definitive answer that if you have fibroids, you cannot take hormone replacement. Any other questions? So estradiol patch. You said that, okay, so the patch is bioidentical. So if it's an estradiol patch, this is these little things. A estradiol patch is bioidentical. And yes, it's a very good option. I prefer pellets of all the forms. I like also creams just because I can alter my dosage. I can be very specific with my dosing, but a patch is also okay and is not synthetic. You can get synthetic versions of estradiol patches, but most of them now are going to be bioidentical. Any other questions? And you can unmute yourself as well, if not. All right, ladies, I hope this was helpful. And if you guys have any additional questions, feel free to send us a DM. And I appreciate you guys participating. So I will see you guys next week.